Hello everyone, my name is Rebecca Blatzheim, and this is my World AIDS Day project for HSC 4593. Today, I will be discussing what World AIDS Day is and the HIV/AIDS epidemic in Mexico. First off, World AIDS Day is celebrated annually on December 1st. The World Health Organization called for this day of recognition in 1988. The purposes of World AIDS Day are to unite people in the fight against HIV and AIDS, show support for those who are HIV positive, and commemorate those who have passed from HIV and AIDS. This year, on December 1st, people can show their support by wearing a red ribbon and using the hashtag RethinkHIV. This year's World AIDS Day campaign seeks to reveal the truths about HIV and AIDS and eliminate stereotypes and myths about the disease. For more information about the 2015 World AIDS Day campaign, you can visit worldaidsday.org. Moving on, I will now introduce you to Mexico. Mexico is a country in North America. It is located south of the United States and north of Belize and Guatemala. It is estimated that the country has a population of 121,736,809 people as of July 2015. It is also estimated that this year, the median age of Mexico's citizens is 27.6 years old, and the life expectancy at birth is 75.65 years. In 2012, the majority, at 62%, of those living in Mexico identified as Mestizo or Amerindian Spanish. The vast majority of Mexicans also identified as Roman Catholic in 2010. In addition to these statistics, the estimated literacy rate for individuals aged 15 and older who can read and write during 2012 was 95.1%. And in 2014, the country faced a 4.8% unemployment rate. All in all, Mexico is a densely populated and diverse country. Now we will look further into the HIV and AIDS epidemic in Mexico. As of 2014, the HIV and AIDS prevalence rate in Mexico was 0.2% among adults ages 15 to 49. During the same year, an estimated 190,000 people were living with HIV in Mexico. 7,500 people were also infected that year, and 5,900 people died. Of the 190,000 people living with HIV, approximately 2,900 people were children between the ages of 0 and 14. In addition, less than 100 children between the ages of 0 and 14 were among the 5,900 people who died of HIV and AIDS-related illnesses. Keeping the HIV statistics for Mexico in mind, there are apparent factors that contribute to the prevalence rate of HIV and AIDS in Mexico. According to avert.org, the world HIV prevalence rate in 2014 was 0.8% as compared to Mexico's 0.2%. The low HIV prevalence rate is most likely influenced largely by religion, education, and unemployment. The vast majority of Mexico's citizens are Roman Catholic. This religion stresses the importance of abstaining from sex until marriage. As a result, followers of the church are less likely to engage in high-risk sexual behaviors. These factors include unsafe sex and having multiple sexual partners. Education in Mexico also contributes to the country's low HIV prevalence rate. The literacy rate at 95.1% is fairly high compared to that of other countries. As a result, more people are able to read and understand information about HIV and AIDS. This in turn helps people ensure that they are taking the necessary preventative measures. Finally, the low unemployment rate aids Mexico's low HIV prevalence. With more people working, there are most likely fewer people resorting to selling their body to make ends meet. Prostitutes are at an increased risk for contracting and spreading HIV since they have multiple sexual partners and often practice unsafe sex. Before I move on, it is important to mention that the availability of injecting drugs and the lack of people getting treated for HIV and AIDS hinders the country's HIV prevalence. Since people can easily access injecting drugs, there is a higher chance that people will share needles or unsterilized needles to obtain their high. The easy access to drugs and the prevalence of prostitution in Mexico, combined with the low rate at 50% of people who are HIV and AIDS positive receiving antiretroviral therapy, hinders the low prevalence rate of HIV in Mexico. In Mexico, the major modes of transmission of HIV include sexual activity, sharing unsterilized injecting drug equipment, mother-to-child transmission, and blood transfusions or other medical procedures. During sexual activity, HIV can be passed to partners during anal, vaginal, or oral sex. Anal sex is the riskiest sexual behavior, while oral sex is the least risky. HIV can also be passed from a mother to a child during pregnancy, birth, or while breastfeeding. With that being said, the groups of people in Mexico who are at the highest risk for becoming infected with HIV are people who inject drugs, migrants, men who have sex with men, and female sex workers. The group that is most affected, though, is the injecting drug users. This is because of the availability of injecting drugs to Mexicans and the lack of availability of clean and sterilized injecting drug equipment. In order to prevent the transmission of HIV and reduce the presence of HIV in Mexico, the federal government as well as non-governmental organizations are stepping in. First, the Mexican government established a goal for this year using education. The goal is to reduce the number of schools who do not provide comprehensive sexual education by 75%. By educating youth on sex and the risks involved, students may be less inclined to be sexually active and/or they may choose to use protection when they are sexually active. Second, non-governmental organizations are stepping in to prevent the transmission of HIV. Two examples of these organizations are Previn Casa and Programa Compañeros. Both of these non-governmental organizations focus on the Mexico-United States border, where prostitution and injecting drugs are major issues. Previn Casa aids sex workers and other at-risk populations. Using their mobile clinic, Previn Previn Casa is able to provide services that include HIV testing, free condoms, and clean syringes. Programa Compañeros also provides services to high-risk populations. This organization created Mexico's first needle exchange program. It is also called the Harm Reduction Program. In addition, they offer rehabilitation services and outreach programs for women, children, homosexuals, and prisoners. These organizations have made a tremendous impact on the Mexico-United States border by providing a multitude of services. However, when prevention efforts fail, people become infected with HIV and need to seek treatment for this disease. The prescribed treatment for HIV is antiretroviral therapy. During 2014, 97,402 people in Mexico received antiretroviral therapy. This is approximately 50% of the total number of people living with HIV in Mexico. In addition, during 2013, only 75% of HIV-positive pregnant women in Mexico received this therapy. It is important to mention that pregnant women who receive this therapy give their children a less than 1% chance of becoming infected with HIV via mother-to-child transmission. There is good news. Antiretroviral therapy saved the lives of 5,400 HIV-positive individuals in Mexico during 2014. With added support and education from both governmental and non-governmental sources, the number of people receiving antiretroviral therapy and the number of lives saved due to antiretroviral therapy could be vastly improved. Looking back, it is important to remember four things. First, World AIDS Day was created to unite people in the fight against HIV and AIDS, show support for those who are HIV positive, and commemorate those who have passed from HIV and AIDS. This year, you can do so by wearing a red ribbon and sharing the hashtag RethinkHIV. Second, As of 2014, 190,000 people were living with HIV in Mexico. 2,900 of them were children between the ages of 0 and 14. Only half of these individuals are receiving antiretroviral therapy. Third, with an increase of individuals receiving antiretroviral therapy, the number of deaths due to HIV and AIDS-related illnesses could be significantly reduced, and the number of lives saved could be significantly increased. Fourth and finally, the key to improving the prevalence of HIV and AIDS in Mexico is through prevention. Prevention methods include education and the availability of resources. These methods can be carried out by both governmental and non-governmental sources. So as we approach December 1st, please think about what you and others can do to help improve the HIV and AIDS epidemic in Mexico as well as the rest of the world. Please stay tuned for a public service announcement for injecting drug users in Mexico. This concludes my World AIDS Day project and public service announcement for the country of Mexico.